Hello, everyone. Welcome to Season 3 of the Rhode to Pregnancy podcast. We're so excited to bring you a brand new season centered around the third trimester and the transition into labor, delivery, and postpartum care. I'm one of your co-hosts, Malia.
And I'm Ashley Houlihan. For those of you who are new to our podcast, Malia and I are third-year medical students at the Warren Medical School of Brown University, and we created this podcast to help make pregnancy information feel more accessible, understandable, and less overwhelming for our listeners, especially those in Rhode Island.
If you haven't listened to our previous 2 seasons yet, we definitely recommend going back and checking them out because they walk you through the first and second trimesters of pregnancy and lay a great foundation for everything we'll be discussing this season.
Exactly. So in this first episode of Season 3, we'll be starting off with a general overview of the third trimester of pregnancy. This trimester is different than the previous 2, and is often when a lot of people start to feel like, okay, this is really happening soon. There are both physical changes and a lot of planning that start to come together during this time.
So to begin, let's define the third trimester. The third trimester is from 28 weeks and 0 days to 40 weeks and 6 days of pregnancy. It's basically the final stage of fetal development before birth.
And during this time, the fetus is doing a lot of final preparation. The organs are maturing, especially the lungs, and the baby is gaining most of its weight during this period.
So Ashley, what are some of the biggest changes happening to the baby during this third trimester?
Yeah, so one of the biggest changes is rapid growth. By the end of the third trimester, most babies are about 19 to 21 inches long and weigh around 6 to 9 pounds, although that can vary.
And development-wise, a lot is happening too. The fetus can see and hear by the end of the third trimester, and the brain is continuing to develop at a very fast rate.
The kidneys and lungs are still maturing, and lung development is especially important because they need to be ready for breathing after birth. By 38 to 40 weeks, the lungs are generally mature enough to do that.
By around 36 weeks, many babies start to move into a head-down position, which is called cephalic or vertex presentation. And this is in preparation for birth through the vaginal canal. And that's also when people might hear about lightening, which is when the baby's head drops into the pelvis.
Another interesting point is that the skull bones are still soft and not fully fused. That flexibility helps the baby pass through the birth canal more easily during delivery.
By 38 to 40 weeks, lanugo, which is that fine body hair that covers the baby, has mostly disappeared, and the baby is also covered in vernix, which is a protective waxy coating on the skin.
So now shifting to the pregnant person. What changes are happening in the body during the third trimester?
Yeah, so this is the part where people usually start to feel it more physically. As the baby grows, movements become stronger and more noticeable. And while the pattern of movement may change as the baby grows and has less room, it's really important to continue paying attention to regular movement and to contact your healthcare provider if you notice a significant decrease in fetal movement. In addition to feeling more movement from the baby, a lot of common pregnancy symptoms become more frequent too. Things like back pain, shortness of breath, heartburn, constipation, swelling, and frequent urination.
Yes, and that shortness of breath happens because as your baby grows, the uterus sort of pushes up underneath the lungs, making it harder for them to expand to allow you to take a deep breath. And needing to urinate more often happens because the baby's actually pushing on your bladder, especially as they start to move lower in the pelvis right before birth.
Yeah, so you can sort of think of it as the baby's just taking up space inside of you. And some people also notice heart palpitations, which can feel like fluttering or skipped beats. These are often benign or normal, but it's always important to mention them if they come with chest pain or shortness of breath.
And then there are Braxton Hicks contractions, which you've probably heard about before. They're often described as practice contractions. They feel like tightening in the abdomen, but unlike true labor, they're irregular and don't get progressively stronger. These should also go away.
We also see things like varicose veins, spider veins, and hemorrhoids due to increased blood volume and pressure from the growing uterus. And a lot of these symptoms can be managed with simple things like elevating your legs, staying hydrated, increasing your fiber intake, and avoiding prolonged standing or sitting.
You can also try using compression socks if you feel like your feet or ankles are getting more swollen. And while many of the symptoms are normal during the third trimester, as we've discussed, there are some situations where you should contact your healthcare provider right away. These are things like noticing heavy vaginal bleeding, leaking fluid, severe headaches, vision changes, severe abdominal pain, if you notice your baby's moving less, or if you see signs of preterm labor.
Exactly. So, preterm labor is labor that begins before 37 weeks of pregnancy. And signs can include regular contractions, pelvic pressure, low back pain, or leaking fluid. If any of these symptoms occur, it's important to contact your healthcare provider right away.
Let's talk a little bit about prenatal visits. How often do they occur during the third trimester, and what is actually happening at them?
Yeah, so prenatal visits become more frequent as you get closer to delivery. Typically, providers will monitor your weight, your blood pressure, and your fundal height, which is the distance from your pubic bone to the top of your uterus. It's a way to measure fetal growth. And they'll also be checking the fetal heart rate. They'll also ask you about symptoms like contractions, fetal movement, swelling, headaches, vision changes, basically everything that we discussed before. And toward the end of pregnancy, your provider may also check the baby's position on an ultrasound or with their hands to see whether the baby is head down.
Now, depending on your healthcare system and your individual pregnancy, some visits during this trimester may be conducted virtually, but in person visits become especially important as delivery approaches in order to monitor all of what Malia just mentioned.
And there are also a few key tests and vaccines during this time as well. One big one is Group B strep screening.
Right. Group B strep, or you may hear it referred to as GBS, is a bacteria that can live in the vagina or rectum without causing symptoms in a pregnant person. But it can be very dangerous for the newborn baby during delivery. And this is why everyone is screened at around 36 weeks.
Exactly. And if someone tests positive, which is very common, they'll get antibiotics during labor to reduce the risk of transmission to the baby.
Vaccines are also really important in the third trimester. The Tdap vaccine is recommended between 27 and 36 weeks to help protect newborns from whooping cough.
And depending on the time of the year and eligibility, RSV and COVID 19 vaccines may also be recommended to help protect both the parent and the baby. We'll have an episode this season specifically on vaccines in pregnancy, so make sure you watch out for that.
Malia, what are some important things to prepare for during this trimester?
Well, a big one is creating a birth plan or birth preferences, things like pain management options, labor support people, and delivery preferences. Our next episode will focus on creating a birth plan, and we'll talk about pain management options in a future episode too.
This is also when people start packing a hospital bag, choosing a pediatrician, installing a car seat, and preparing the home for the baby. Childbirth and breastfeeding classes can also be really helpful during this time, especially for first time parents.
And it's also a good time to think about postpartum support. It's helpful to think about who will be available to help with things like meals, recovery, emotional support, and newborn care once the baby arrives. Ashley, when it comes to support people, how can they help during this time?
Honestly, they can help a lot. Attending prenatal visits can help them understand what's happening and feel more involved. They can also help with household tasks, preparing supplies for the baby, and just making sure the pregnant person is rested and feeling supported.
Yeah, great points. And emotional support is huge too. This trimester can bring excitement, but also anxiety as delivery gets closer. Research consistently shows that having a strong support system can make a big difference during the postpartum period. So it's important to talk to your provider if you're feeling concerns about having adequate support after you deliver.
Exactly. Now, as we wrap up this episode, it's important to remember that every pregnancy is different. Some people feel a lot of these symptoms, and others don't really feel any.
And if anything ever feels concerning or different from what's expected, it's always best to check in with your healthcare provider.
Over the rest of the season, we'll be diving deeper into many of the topics we introduced today, including birth plans, labor, pain management, preeclampsia, C-sections, NICU stays, induction of labor, and more.
Exactly. We covered a general overview today, and it can feel like a lot of information, but each episode will cover these topics in more detail. And as always, this podcast is intended for educational purposes and shouldn't replace medical advice from your healthcare provider. So if you have any concerns about your pregnancy or your health, please reach out to your team.
Thank you so much for joining us for the start of season 3. We hope this overview has helped you feel more prepared for what to expect during the third trimester.
Be sure to join us next time when we'll be talking about creating a birth plan and thinking through your preferences for labor and delivery. See you next time.